Today we're talking about pregnancy hair. Joining me is my good friend and coworker, Kathy. So Kathy, this is your second pregnancy.
Yes, it is.
And with your first pregnancy, I'm sure you noticed some hair changes.
I did. With my first pregnancy, my hair was a lot shorter. So during the pregnancy, I didn't really notice too much of the thickness because it was a lot shorter, so it's not something that I was putting up. But afterwards, I did notice the amount of hair that did fall out. And then just some of the challenges that I had with having short hair and having a newborn.
One thing that I know as an educator and as someone that works behind the chair, and you yourself being a hairstylist, that I personally haven't gone through pregnancy, but I know there's some things that I wouldn't recommend for pregnant women, such as having a major hair change. What do you suggest?
Yeah, so ideally you want to keep your hair something that is going to be easy, because especially when it's your first child, you don't really know what's about to happen. So oftentimes pre-pregnancy, your hair is good. It's easy to work with, but then post-pregnancy, when you're in your postpartum and you start losing a lot of that hair, a lot of women freak out and want to cut their hair short, but don't think about what that's going to be like for them with the newborn. So you still want to be able to put your hair up in a ponytail or anything that's going to be easy for you to maintain while having a newborn.
Yeah, something that's going to be out of the way.
Something that'll be easy.
After pregnancy, when would a woman expect for her hair to return to normal?
So on average, it should return to normal within the first year. So you'll notice the amount of hair loss happen 3 months postpartum, but by 12 months postpartum, your hair should start going into the stage that it was pre-pregnancy. If you're still noticing excessive amounts of hair loss, it's important that you talk to your doctor, because it could be further underlying issues such as low iron, a thyroid condition, just anything else like that. So it's really important to speak to your doctor just to confirm that there's nothing further.
As someone that specializes in hair cutting, I know for me, when I have a pregnant client, I do tell them to avoid any drastic changes, something too short, or even bangs when they're pregnant, just because I feel like how it might affect them post. But one thing that they ask me that I have a hard time explaining to them is, how does hair color affect them when they're pregnant? Or does it even?
Well, I think the big thing is it's all about personal preference and your comfort level. So the big thing is within the first trimester, a lot of women may notice because you're a lot more sensitive, the smells may bother you a little bit more, scalp sensitivity may affect you. So that is where you mainly notice it. As far as it being harmful to the baby, I've worked during both my pregnancies, working on my clients, doing hair. I only specialize in hair color, so I felt comfortable and safe doing it. What the big thing is that you want to keep your color or anything that you're doing that is going to be more low maintenance, especially after you have the baby. You're not really going to have the luxury and the time to be in the salon on a 4 to 6 week basis. So those colors that do require a lot more maintenance, maybe you want to put on hold until you have a little bit more time, so that way you can get back into the salon in the required time frame.
We know a lot happens to a woman when she's pregnant, but what specifically happens to your hair?
Before you're pregnant, the average woman, or the average amount of hair that is lost, is anywhere between 80 to 100 hairs. When you're pregnant, your hormones are at its highest, and so you start growing a lot more hair on your head, which is where a lot of women notice it's the most, or it can be in other areas as well. But so the hair is growing, but it's not really shedding. So you're not losing as much hair as you once did pre-pregnancy. Now, post-pregnancy, and it usually happens about 3 months after delivery, that's where the hair starts to fall out because the hormones are balancing out. So pre-pregnancy, you lose about 80 to 100 hairs a day. Post-pregnancy, women can lose up to 400 hairs a day.
400 hairs a day? Wow, that's a lot. No wonder women feel really afraid after they've had post-pregnancy.
For sure. And the challenging thing is that not every woman is going to lose that much hair. So with my first pregnancy, I didn't really notice that amount of hair falling out, and I didn't have those clumps or those bald patches as some women do. The challenge is that every pregnancy is different. So for one pregnancy, you may not lose that much, or maybe you did, and for your other pregnancy, you will or won't. The benefit or the thing to remember is that it is short term. So eventually, once your hormones do balance out, everything will start to go back to what it was, but it is a little bit of a challenging bit.
During post-pregnancy, it is important for women to keep in mind that it is just temporary, that they are losing approximately these 400 hairs a day, and any additional hair that they might have noticed will be slowly kind of falling off from the body. I personally feel like it's important to make sure that you don't cause any additional strain to your hair during this time, especially a lot of times I've noticed with my clients that they lose a lot of hair through the front. So things like a tight hair elastic would be a no-no. You want to stick to something that's cloth or softer. A cloth headband would be good. The telephone cord hair elastics are also really great. Is there anything else that you would recommend, having gone through the experience yourself?
Well, the big thing is you don't want to add any more strain to your hair, which is what you said. So keeping in mind that it is short term, and anything that is those really tight elastics or even tying your hair up when it's wet will just add more to that breakage of what is happening.
Well, I want to thank you so much, Kathy, for being here. And I am looking forward to seeing the new baby once she comes.
Thank you. Thanks for having me.